Bonjour, bonjour à toutes et à tous.
Good afternoon, everyone. Welcome to this press conference with Premier François Legault, Health Minister Christian Dubé, and Health Director Horacio Arruda. Mr. Premier, the floor is yours. Chief of the Government, okay. Hello, everybody. Listen, last night, as we do just about every Monday night, we looked at the situation in the different regions of Quebec with the Minister of Health and the Director of Public Health, the experts from the NSPQ and the INES, and the situation is going quite well. We are truly headed in the right direction. We have a decrease in cases and hospitalizations. The rate of positivity went from 2.8 to 2.6 on average over the past week. So we are getting through the third wave, but we must continue to be prudent. First thing I want to announce, first of all, good news in the Outaouais. We have truly taken control of the situation. There's a decrease in cases and hospitalizations, so I'm announcing that as of next Monday, Outaouais will no longer be in emergency measures, and that means concretely that the curfew will go to 9:30. High school students will go back to school, except for secondary 3, 4, and 5, which will be on alternating days, and non-essential businesses will reopen. A word to say to the police officers and people at the border with Ontario, of course, the situation is more serious in Ontario, so we're asking police officers to continue to do some monitoring on a random basis. But it's important that people from Ontario respect the rules of Ontario. They're not supposed to go to businesses in the Outaouais, and it's important that everybody be prudent, and we will ask our police officers to continue their work between Ottawa and Outaouais. Of course, a lot of people work in one of the two cities, but for people who don't absolutely need to go into a business is prohibited. So things are going well in the Outaouais. It's also going well in Quebec, in just about every region except for 3 regions or sub-regions where things are continuing. We're continuing to see a lot of transmission. The Lower St. Lawrence, 4 RLSs, the Témiscouata, Kamouraska, the Basque, and Rivière-du-Loup. Unfortunately, the situation does not allow us to ease emergency measures. So that means that in these 4 zones, they'll continue to have the curfew at 8 p.m. Unfortunately, the students in high school will continue with online learning, and non-essential businesses will remain closed. However, in Rimouski, the situation has improved, so we will go back to the red zone measures. That means a curfew at 9:30. High schools will open, and non-essential businesses will open as well. There are 2 other regions that are worrisome. First, in Chaudière-Appalaches, there's Beauce and Etchemin, and in the Estrie, there's the RLS, Le Granit, near Lac Mégantic. We will reopen high schools with the permission of public health in these 2 areas, but the curfew will remain at 8 p.m. and non-essential businesses will stay closed. So I am sending out a call. It's a zone that's with a lot of restrictions, but in the Beauce and the Lower St. Lawrence and near Lac Mégantic, we really have to be more prudent. There is a lot of active cases given the percentage of the population, and it's important that we remain very prudent with as few contacts as possible. I was saying in the other regions it's going well, amongst others. There are 3 big regions around Montreal, Lanaudière, Laurentide, Montérégie. We feel that we're getting close to the orange zone in restaurants, so soon I hope to have the approval of public health in these 3 big regions to go to orange. What I'm most pleased about given the current situation, is that all of our schools are open, except for a few places in the Lower St. Lawrence, unfortunately. But I challenge anyone to find in North America a place where we kept the schools open like we did since the beginning of the pandemic 14 months ago. For us, it was always a true priority. And I'm calling out, I'm asking people to be prudent until the 24th of June, till the end of classes. It's important that our students stay in school. And I also take this opportunity to say thank you to the teachers, to the administrators in school, to the staff in schools who have allowed us to keep our children in school. It's important for their learning, it's important for their social lives, for their mental health. So I'm very pleased that we are in this situation. Otherwise, summer's coming, and I think this summer will be better than last summer. When we look at the hospitalizations and new hospitalizations, we've got half as many as we did at the same time last year. When we look at the deaths, we've got 10 times fewer than at the same time last year. In addition, we've got the vaccination campaign, which is really going well. You saw in the CHSLDs, all of those who had received a first dose have now received their second dose, and that means that our most vulnerable are protected. This week, we should surpass 75% for 50 and up. Yesterday, things went well with the 30-year-olds, their registration, and tomorrow, people 25 and up, it'll be their turn. So I want to call upon all the young people in Quebec. Vaccinating will lead to solidarity and to freedom, and it'll bring us a nice summer. So please go get vaccinated. All young people, please go. We're counting on you. We need, in order to have community protection, we need your collaboration. So we are inviting, and the Minister of Health did this on Facebook as well this morning. We're trying to find every way possible to reach everybody. So I'm calling upon parents and friends, young people. As of tomorrow, it's going to be 25 and up. They can get vaccinated. So in closing, I think that we are getting through the third wave. We're continuing to have discussions with public health. I hope in the next weeks we'll be able to come up with a complete plan to ease measures, a gradual return to normalcy. And I know we're all very anxious to see our friends and loved ones, so let's continue to be prudent over the next few weeks. The summer's coming, and things are looking up.
The situation continues to improve in Quebec. In Outaouais, the population has succeeded in turning the situation around. I'm announcing that the special emergency measures will be lifted on Monday, so students will go back to school. The curfew will be at 9:30, and non-essential businesses will reopen. So thank you to all the people from Outaouais for their efforts over the past weeks. We also ask our police officers to verify the arrival of people from Ontario. It's important that they follow their government's rule and that they don't go to stores in Outaouais. There are still 3 regions where the contagion is worrying in Quebec. First, in Bas-Saint-Laurent, we have Témiscouata, Kamouraska, les Basques, and Rivière-du-Loup. Emergency measures will continue in these regions, but the situation is under control in Rimouski, where we'll lift the emergency measures on Monday. In Chaudière-Appalaches, we have Beauce and Etchemin, and in Estrie, we have the area of Granite, including Lac Mégantic, where the contagion is still very high. So secondary schools will reopen on Monday, but the curfew will remain at 8 p.m., and non-essential businesses won't reopen. So the vaccination is going very well. It's now the turn of young people. I ask them to get vaccinated as soon as they can. It's the best way to have a great summer. We're going through the third wave together, and we're getting closer to the finish line every day, so thank you.
Merci. Nous allons maintenant
Thank you. We will now go to the question period.
avec François Carabin, Métro.
Question. Hello. First, a question for Mr. Dubé, a logistics question. The vaccination campaign is going well, and it seems that we will be able to have vaccinated or have reached the 75% objective earlier than the 24th of June. That seems to be what we're hearing. So I'm asking you, what are we going to do with the appointments that were made? For the second doses, will we simply ask Quebecers to come 2 weeks earlier, for example? Could it not cause problems? I appreciate the question because one of the first things that we have to wait for, I talked about the recommendation of the CIC last week, the Immunization Committee for the 12 to 17-year-olds. And obviously, the question of the 12 to 17-year-olds will essentially go before the second dose. So I want to have the recommendation of the CIC. I was told that I would have it probably Wednesday of this week. And that is when we will see if we need to move up some appointments. As you can see, our 12 to 17-year-olds, we would vaccinate them probably towards the end of June. And that's 500,000 people. You remember when we talked last week? So I prefer to confirm that the CIC agrees with that period of time so that we can say how we will reorganize ourselves, if required, for the second dose. But currently, I prefer to wait for the recommendation of the CIC. Still on vaccination, you saw, Mr. Dubé, that Montreal and the Quebec region is a second region in Quebec where there's the lowest vaccination rate. So how will you manage this problem? Well, there are two reasons. There's a lot of people who were vaccinated in Montreal, but who were residents from another place. We have a lot of healthcare workers, or workers, period, who come to Montreal, and they were vaccinated in Montreal. So I could say that Montreal was, some vaccines were used by other people, but it's still for the common good, so there was no problem. The second point is that we realize that we're checking this with the RAMQ. I would like it to be adjusted for the past few days, but I was told that this would be done soon. We probably have something like 30 to 40,000 addresses that we need to correct, and that would we'd probably add about 2% in Montreal, because you know that there are more moves in Montreal than there are in the 450. So I was told that there were some address corrections to be made between 30 and 40,000 people, and perhaps that will correct for another 2% that would be added to the vaccination rate in Montreal. So we're looking at this now with our teams in order to correct that data as quickly as possible. Question? You just said that this year we're in a better situation for the summer than we were last year. It's been 6 months that we've had a curfew everywhere in Quebec. This weekend, it's going to be 20 degrees, beautiful sunshine. Is it not an irritant now? Is it still justified to have a curfew, first of all? And secondly, I don't know if for Mother's Day you went to a park, but there were 4 picnics per square foot. Are we not at a time where we should allow some outside gatherings in backyards? I don't want to make an announcement today, given that the work is not finished, but I will tell you that our plan to ease measures will be full of hope, a bit more freedom, but also some prudence. So I want people to know that we are very conscious of this. When we do surveys, the Institute does surveys with the population on the curfew. Regardless of what we can say, a lot of people consider that the curfew is still an important element. I'm just talking to you about the surveys that were done recently. And some people think that the measures are not restrictive enough. Just to tell you, actually, that there is still that element. And that is why, for me, the important message for Quebecers is that it's coming. And the best way to have some easing is vaccination. And I invite young people in particular, because we're going to have youth weeks, and they are part of the solution. So the month of May is vaccination month, and it's through this that we will be able to bring our epidemiology down to colors like we've never seen, and therefore we'll have more freedom. I'd like to hear you on people who have died. There are hundreds who have died in hospitals because of COVID-19 after having it after having been infected in a hospital in Maisonneuve-Rosemont, there's 150 deaths. So are you concerned by this situation? Is it to the point of accelerating the reconstruction of this hospital? Well, we saw most of the hospitals where we had more significant problems, because we had some just about everywhere, but Maisonneuve-Rosemont is a good example. Saint-Jérôme, Saint-Eustache, the hospitals, St. Mary's, hospitals that are a little bit dilapidated. And I think that the proximity for most people who have already gone in those hospitals, we see that the hallways are very narrow and it's difficult to move about if there's anything placed in a hallway. So you're absolutely correct. Twice in the past 2 months, I've gone to Maisonneuve-Rosemont to see what are the choices. We're really looking at this. But I think that we saw how we're not in the same situation with the CHUM and the CUSUM when we're in modern hospitals. So, of course, there was a de-investment, a little bit like in our schools, but I think in our hospitals, it was very obvious. So I managed to get from my colleague at the Treasury and in Finance an improvement or an increase in funding for our hospitals. So we do have some projects on the drawing boards to do some significant renovations in our hospitals. Question. In their inquiry, Mrs. Castonguay, did she meet each one of you? How many times and for how long, as well as Mrs. McCann? Well, I was met for about an hour. I met for about an hour with Mrs. Castonguay, Mr. Arruda, Mr. Dubé. I think for me it lasted at least an hour and a half. But I spoke to her a few times on the phone because we have to ask for information because often the information goes through the Ministry of Health. I had several contacts with her. I had a meeting that lasted 2 hours, if I remember correctly, between an hour and a half and 2 hours. To come back to the pandemic, you alluded to the hope that's coming, Mr. Legault. And you talked about the orange zone and restaurants. What is missing in order to give what the restaurant owners need or people who are waiting for the curfew to be lifted? What's missing to get there? What's missing is less intense transmission to come back to levels where there's a lower incidence, but it's coming. And to contribute to this, vaccination with the first dose and with the second dose, of course, will allow us automatically to have an effect on the epidemiology. The nice weather as well. So I don't want to make an announcement today. We will go progressively, but we will give all activity sectors some hope. Question? Hello? We know that when it comes to the 30 to 34-year-olds, Mr. Dubé, you put this on social media, 50% of people have made an appointment. Do you have a fear with younger people? Because they are the ones, that's where we have the most outbreaks after the workplace, it's schools. Do you fear that they won't get vaccinated? Well, I'll distinguish between the 12 to 17-year-olds and the 18 to 30-year-olds. The 12 to 17-year-olds, so the good news, like I said, is that we'll be able to handle this at the end of June, if everything is confirmed, because that's truly where we had transmission for the reasons that we know. 18 to 30-year-olds, I will tell you, I was pleasantly surprised, and we talked about this last night, to see how quickly they took appointments over 2 days, having reached 50% in less than 36 hours, and I follow this very closely. So it's very good news that this age group has taken these appointments so quickly. We'll see what it'll be at the end of the day, but at the same time, I trust them because I have a young person at home, and he tells me that they're frustrated and they can't wait to see their friends, etc. So they understand, and that's why I spoke to a specialized reporter in a magazine for young people today. And I think that there's such a need for them to get vaccinated. It's fantastic. So I congratulate them because what I said in my letter this morning, and I'll say it quickly, we kind of left them aside since the beginning. We asked them to make sacrifices. They're the ones who had jobs in restaurants, part-time jobs. They're the ones who had to make sacrifices for the elderly because we asked them to cut their social contacts and with their grandparents, but we didn't give them much. But now we have the opportunity to put the ball in their court, and that's why I really wanted there to be a priority this week to do things correctly. So when they react so quickly, I'm very pleased, and I'm anxious to see the second category, which is starting, perhaps the appointments will be open tonight. I'm very pleased to see how quickly the people are registering for their appointments. It's been over a year that we've been in this room talking about COVID. Can we guarantee, because I remember what you were saying a year ago, that there will not be a fourth wave? Well, listen, I would tell you, and I'm going to let the expert in waves speak. What I can tell you is that it's very encouraging how we were able to, until now, control the third wave. I think that's what we've learned from the first and second waves. It's how to control it. We saw it elsewhere. And look, we saw how in India, what's happening in India, there's a fourth wave is possible. What I'm telling you is let's continue to show that we are able to control the new variants and to minimize the impact of these waves. And I think that already that's a very good thing for us. Dr. Arruda, on the fourth wave, the virus doesn't give us any guarantees, and it's a virus that can mutate. So we can't predict anything with that kind of virus. It's unbelievable, but that's how it is. However, we've got conditions to control it in Quebec, and I want to tell you that having vaccinations is a privilege when we look at the global situation. So go get vaccinated, please, because that is how we will be able to probably avoid a fourth wave. Will there be a reopening of activities next year, or will there be other coronavirus cycles in the years to come? It's possible. It's one of the scenarios that experts are looking at, but let's try this time. And when I look at what's happening elsewhere, I pinch myself every night when I look at Quebec's data, and that's thanks to everybody's efforts, everybody, and I thank you for your efforts. A bit more, we're at the end of the marathon. Vaccination, and let's go. Question? With 3.6 million, Mr. Dubé, towards the objective of 75, we've already surpassed 50%, if I'm not mistaken. Towards the end, Mr. Arruda has said this, a marathon vaccination, towards the end, the curve will flatten in the sense that those who want to be vaccinated were vaccinated first, that's for sure. Do you have, well, we all saw the ad, but do you have motivation tools? I won't say like some place in the U.S. where they offer a donut or a beer, but will there be some incentives at some point to say, if you bring your neighbor, you'll get a reward or something like that? Are you thinking about this? Well, listen, we'll start with the good news, right? We will publish a table this afternoon, 3.6 million first doses. We already have 1 million appointments in the bank that are added to this, so that's 4.6 million appointments by approximately the first week of June. So we're already at 4.6, 4.7 million. That means that we're missing approximately 700,000 to reach in terms of appointments. And that is why I'm saying that Youth Week this week gives us the possibility of reaching a great number, a great proportion of these 700,000 appointments that we're missing to reach the objective. So I'm repeating myself, Mr. Laforest's question earlier. It's very important that young people take advantage of this opportunity up until Friday. First. Second, you saw that we will, once we will have taken all of these appointments, we'll see what's happening in the next 3 to 4 weeks. Will we be at 75 or 78%? I don't know. We'll see by Friday. Next week, I will tell you what was added to this. Are we going back to walk-in clinics, vaccination clinics? We saw that we had a lot of success with the walk-ins. You'll remember particularly about a month ago. But we didn't want to do it this time because we wanted to maximize the appointments with the visibility that we had with Pfizer. So the walk-ins, you saw the Premier's announcement this morning with the businesses. You saw that we have a second clinic, a drive-through clinic that will be added. There will be other things like that, but I always thought that there should be a bit more music in our vaccination centers, and we're looking at that. So I'll stop here because I'm going to reveal some secrets that I shouldn't be revealing. Something that I learned with the experts last night. Let's say that we're aiming for 75% vaccination rate. To reach 75% of the population that is protected. What I understand is a first dose protects up to 80%, let's say. A second dose protects up to 90, 95%, and people who have already had COVID are protected up to 90%, let's say. So there is a mathematical calculation that is done in these three categories so that in total it gives us 75% protection. So I thought it was interesting because what that means is that when there's a second dose that's administered that helps us, and unfortunately, the 10 or 12% who had the illness, well, that also helps us. So all of this added together, that's where we aim for 75, 78%. So I think it's quite interesting to know. I had not understood that. I know that you knew that for a while, but I did not. You said this earlier. The residents in CHSLDs have all received their 2 doses. When will these people be able to live again? Do you have a timeline for these people? Well, you know that it's always the immunity kicks in after a few weeks. So I say not just for people in the long-term care homes, but for everybody. What I'm worried about right now, and I'll answer your question, but what I'm worried about right now is people in seniors' residences, the RPAs. We started giving the second doses a week ago, and now we'll accelerate because we're done with the CHSLDs, but people must be very prudent when they only have 1 dose, particularly when we're older because our immune system is not as strong. So to answer your question, in CHSLDs and RPAs, while they're waiting for the second dose, people have to continue to respect the public health measures. Once we publish the reopening plan, we've already eased some measures. Remember when we allowed the reopening of dining rooms and the RPAs and everything? Well, there will be other measures, but for the time being, we want to vaccinate people in RPAs, and that will be done by the end of May. That's our objective with Daniel Paré. We want to vaccinate all residents and seniors' residences by the end of May, like we just did with the CHSLD. Question?
Juste une petite précision sur le 75%.
The 75%. I get the impression that over the past few days, we're including the 12 to 17-year-olds in the calculation of the 75% at the 24th of June. Am I wrong? No, it's good that you mention it. When we announced, I think it was the 13th or the 16th of March, when we said that we were going to vaccinate everybody by the 24th of June, 5.3 million vaccines, you'll remember that it's calculated on the adult population. So the 12 to 17-year-olds are not included in that. I thought it was important because the target is changing. If we include, it increases my target as well. I no longer have 5.3 million. I have a target of 5.8 million. But I take that as good news because the more we vaccinate, well, the immunity increases. Second question, we're seeing what's happening in India right now. Dr. Arruda, I know that you're the expert in this, but we see what's happening in India. It's an absolute catastrophe. The variant is out of control, and we're realizing more and more that vaccines don't have an effect on this variant. In Quebec, can you tell us the number of cases of this variant that we have? Are we discovering more and more? Is it stable? Where are we? And how are we getting ready for this? Because if ever it comes in, this variant, well, perhaps we could fear a 4th wave. if the vaccine is not effective. Well, the variant was present. It was imported. But up until now, we haven't had any outbreaks, significant outbreaks. There are some cases that came from India, and they isolated, etc. So we didn't have an outbreak or an explosion of the Indian variant. We're concerned, of course. That's why the borders were closed with India. We're worried that it might be imported from other provinces. But for the time being, the situation, this is a marginal variant. Most of our variants are the UK variants, and that one is handled by the vaccine. The other element, I don't want to say that the Indian variant is not of concern. To the contrary. But we also believe that in India, there are a lot of elements, a lot of transmission associated to the fact that people are really, they don't have water to wash their hands. There's a lot of people. They don't have the means to buy masks. So it's a society that, in addition, doesn't have the things that we can afford. And that contributes to the increase in the transmission of the illness. There's part that is related to the virus itself, but there's a part that is also associated to all of the sanitary conditions in India. Question? I'd like to hear you on the measures of the Center for Disease Control in the U.S. The New York Times said this morning that, actually in the past they said that the risk of getting the virus outside was of less than 10%, but now it seems that it's 0.1%. Given the context, how can you justify the fact that we are not allowed to go on a terrace, that we have to wear the mask outside? 0.1%, I see that it's comparable to the risk of being attacked by a shark. This reminds me of a caricature that I saw, your shark analogy, but we heard about transmission outdoors, well documented, that happened in Quebec. I'd have to look at the detail of the study, what they meant by exposure, outdoor exposure, etc. I'd have to analyze it, but I could tell you that we had a few outbreaks where the only contact was outside in a park with young people, because it's true that outdoors there's natural ventilation with air, but you can get the virus. My question for the Premier. The inquiry this morning in Le Devoir on about 20 Aboriginals who said that they were badly treated in the healthcare system. I'd like to know, how do you react to this? How do you feel about this? And are you satisfied with the explanations that were given by the different CIUSs that were mentioned in this inquiry? I think it's sad. I think it's worrisome. But we know, we saw this in Val d'Or and we saw it in different places, in Joliette, amongst others. But this didn't just happen once or twice, unfortunately. And that is why training, staff training, will be mandatory everywhere in Quebec. Now, it's zero tolerance. And the measures that we are putting in place, I think, will help that there be a reduction in these types of events and eventually an eradication of these behaviors, because Aboriginals have the rights to the same services, the same care in dignity and respect like all other Quebecers. So I will make sure, and I think that Benoit Charest and Yann Lafrenière will make sure that everywhere the new rules will be respected, training will be given. There's training as well that will have more long-term impacts, because with young people in school, we also have to raise their awareness. And I think that we have to evolve, and we cannot tolerate this, and I think it's very sad. Question? L'Estrie went to the red zone, but the high schools, or the students in secondary 3, 4, and 5, will continue to go to school full-time. I'd like to know why that is not applied to other schools in red zones, like, for example, Quebec, where high school students just spent 5 weeks online, and now they're going to school on alternate days. So why not apply the same rule in Quebec or other zones, red zones? Listen, I think that there were discussions. Some things were said in the media, but in fact, the Estrie will apply the same measures as elsewhere as of today. I'm not saying that there won't be an analysis that could be done and discussions with the Ministry of Education, but for the time being, the Estrie, what has been agreed upon is that they will go to the red zone and they will alternate in Sec 3, 4, and 5. Well, listen, there were some things that were said, but you didn't hear that from me. There are some discussions being had right now in public health. The different service centers have visions that could be different. There are some who prefer to maintain a certain stability in their approach, especially since we're getting to the end of the year. But these are discussions that are still ongoing, and it could change. I've always said what I say today could be different tomorrow. But currently, the position is that the Estrie will apply the same rules as elsewhere in other red zones. I understand that today you're not going to present your reopening plan, but you're encouraging young people to go get vaccinated, but they're making their appointments now. So can you give us an idea of what the light at the end of the tunnel means? Are we talking about the curfew being lifted or meals between different families indoors? Can you give us an example of that light at the end of the tunnel? I would tell you, already, we've got some zones that are orange and we've got some zones that are yellow. In an orange zone, restaurants are open. In a yellow zone, people from two different bubbles can meet in a house. So already, when I say that we want to go down towards orange and yellow everywhere in Quebec, well, it's a question of time. But in the plan that we will submit shortly, there will be this easing of measures eventually in a certain sequence while respecting certain conditions. And contrary to Saskatchewan, we've got two groups of condition. There's vaccination, but there's also the situation, the epidemiological situation, so the number of cases, hospitalizations in each region. So we have these conditions, and we'll have a beautiful color-coded plan, and that will be out shortly. I got part of it already. There's still a bit of work to be done. We're working very hard on this. Question? To add to this famous reopening plan, Mr. Arruda, you talked about a balance between prudence and freedom. Can you tell us a bit more about this? And Mr. Legault? Is it that you won't present the plan as long as there are some measures in place? Do you have certain rules like that so that you don't send a reopening signal? No, I want to present the plan once it's complete. And for the time being, it's not complete. You have to understand that our plan, as the Premier said, takes into account vaccination, because vaccination, the more we've got people vaccinated, the more we've got people with their 2 doses, the more protected people will be, and they won't have the illness and they won't transmit it. So that will have an effect on the color levels that we've got, right? We've got some levels. And we will add some easing of restrictions from the lower risk, right, so activities that are outdoors. We will add some easings. For example, when people will have received 2 doses, they'll be able to see each other without masks. So all of this is being analyzed, but you'll understand that people they don't get their second dose immediately. There are 2 doses in the CHSLDs, but in the CHSLDs soon, measures will be eased, and that will be the same thing for the RPAs. So we're kind of working backwards, and we will allow certain activities, certain festivals, with measures that are with guides. So it's not gatherings of 10, 20,000 people, but we'll be able to come back to this acquisition of freedom, which will grow depending on the rate of vaccination and the outbreaks and the control that we have of this situation. But, if there's a new variant that occurs, we don't know. But that's the direction that we're heading in. And we hope that the summer will help even more. We don't know exactly what impact it will have, but that's what we're going towards. I don't want to reveal the details of the plan, but we are working on all of this so that people can plan and say, well, I'm going to see what's coming. And that's for individuals and for businesses. And, the tourism industry and the cultural industry, et cetera. Mr. Legault, we heard this morning that there was a data leak in the Place 05 platform. Should the government apologize for not protecting the confidentiality of data of thousands of parents? Well, I think it's very worrisome. For the time being, this data bank is managed by a cooperative, so it's not managed by the government. Is it enough to say that in the future, given that there's personal data, it should be managed by the government? That's something that we are considering. But it's troubling to see that there were two files that were consulted. Both files are in the name of Mathieu Lacombe. It was done overnight, Saturday to Sunday, but we only heard about it yesterday from the cooperative, the independent cooperative. So we're asking ourselves all sorts of questions. It's unacceptable. Of course, we are adopting laws to protect data and organizations that are outside of the government and data that is kept by the government. But I think it's very worrisome that 5,000 families saw their data revealed. I don't want to judge. We don't have any evidence of this. Question. Hello. Mr. Arruda, concerning the AstraZeneca doses, many are afraid that they'll get a second AstraZeneca dose. People are not taking appointments for AstraZeneca anymore. Will we have to give AstraZeneca doses to other countries or other provinces? How will we manage the surplus AstraZeneca doses? Well, we hardly have any left. To my knowledge, they've all been administered or close to it. The appointments have been given. It was a significant addition to increase the number of people who got their first dose. Now, we are waiting for an opinion for our immunization committee to see what we'll do with the second doses. It could be given as a second dose if some is available. There's the mixing of vaccines is a hypothesis that's being analyzed. There are some studies that will be published within 2 to 3 weeks from the UK to allow us to see if we could give perhaps one Moderna or Pfizer vaccine after an AstraZeneca. Are there advantages, benefits? Can we stimulate two types of immunity responses? But for the time being, I'm telling you that in Quebec, we are happy and we have succeeded, and people are protected with the AstraZeneca dose. You'll understand as well that the AstraZeneca, usually, it's 12 weeks, right? The interval is 12 weeks, not 28 days. It's really 12 weeks, and we've demonstrated greater efficacy at 12 weeks with AstraZeneca. So for the time being, I would tell you that we will evaluate the situation, and as I've always said, we will make sure that first people have informed consent. We're not going to give them a vaccine that they don't want to have. And we will make sure that we offer the best combination possible to protect Quebecers while remaining safe. Mr. Legault, concerning the death of Serge Bouchard, I'd like to hear what you have to say. Well, Serge Bouchard was a wise man. I read his latest book. I know there's a word coffee in it, where he talks about his two spouses that he lost. He also talks about the time when he's having a coffee with a spouse in the morning and it's total happiness. But Serge Bouchard was able to speak about simple things while teaching us quite a bit. And I think that it's a big loss for Quebec. And I want to offer my sympathies to his family and his loved ones. Quebec is losing somebody who analyzed our society from every angle over the past few years and who was an excellent author.
À distance avec Raquel Fletcher de Global.
Question.
Good afternoon, everyone.
Good afternoon.
My first question concerns the healthcare staffing ratios and shortages in CHSLDs. Several family members of residents at my amenities, for example, are complaining about loved ones being left in filth for hours and not getting the care that they need. Many claim residents have died from neglect, and families, unions, and experts are all pointing to staff shortages as the problem. Can you react to that?
Well, Raquel, did you say, I didn't hear correctly the name of the CHSLD. I just want to make sure I understand the question here.
My amenities.
Oh, okay. Well, I don't know if there is a specific problem there other than the one that we have with some CHSLD. So instead of answering anything to you, I'll check if there is a specific problem there.
Okay, so my second question then is you mentioned, I believe it was Dr. Arruda who mentioned the CHSLDs, the strict health measures that are still in place even though residents have received their second dose.
Yep.
Those will soon be lifted. I'm also wondering about the RPAs, when the second dose will be administered there, and then when those measures will be lifted, because a lot of those residents, they say that they're not even allowed to leave the building, and they would like to know when they'll be able to have some freedom again.
Well, we're dealing with two different issues when we look at CHSLD and RPAs, as you know. In RPA, people, one of the issues is that people are free to move out of their RPA. So, I mean, this is a normal place where they live in. And right now, the concern that we have is that they have been, most of them, I say most of them, have been vaccinated, and we have started last week vaccination. But in CHSLD, it's long. I mean, this is one person per person. This is a long process. This is not max vaccination. So we have started RPAs last week. We will, I asked Daniel Paré to make sure that we have most of them done by the end of May. He told me that's possible. So this is the focus over the next 2 weeks will be on vaccinating all RPA's residents. So, and we'll see to follow-up question is what will be the measure. I think that once we know they are vaccinated, given the release of those measures next week, when we're ready to announce that, we'll make sure that we put the RPAs in those measures as well.
Thank you. I just have one last question for Mr. Legault concerning the data breach that you were made aware of yesterday. I know that data security has been a huge priority for your government. So how did this happen?
Okay, first, this database was managed by an independent co-op. What we know now is that the breach happened in the night between Saturday and Sunday, but unfortunately, we only learned about it yesterday. I think we have to ask ourselves if in the future we must manage these kind of data ourselves. And of course, we already have 2 bills right now that have been tabled to manage also data from independent and private companies. So we'll have to put more and more focus on the protection of personal data in the future. We're already working on that.
Philippe Potier, de Gazette.
Good day. A question perhaps for Mr. Legault and Mr. Arruda. With the low number of cases being reported in Montreal now, will high school students possibly be able to go back to school on a full-time basis before the end of June? Is that in a projection? Is that going to be possible?
I hope so too. It's what I was telling. There is discussions actually as the year of school is near. to see what would be the best thing. There is discussions also, I would say, with my colleagues in public health and also with, I would say, education ministry and also, I would say, centre de service in different regions.
So there's a chance, or?
There is a chance, yes, but I cannot tell exactly the number actually. There is still discussions.
My second question is to pursue for you, Dr. Arruda, off of Mr. Lacroix's question. Can you tell us, you mentioned in French that the Indian variants that we're seeing are marginal in Quebec.
Yes, it is.
Are you able to tell us any more about where it has been found, how many cases in all, which regions, and are you monitoring it now closely to see if it moves?
Yes, we are. In fact, I need to make some confirmation because I just wanted to see at the NSPQ, there was not sequencing that appears to be Indian one, but there have been in the first test, they are waiting for stories. But we have, I would say, some family coming back from India who were self-isolating for the 14 days, and there was this suspicion of this variant. So that it did happen. I think one case that was also imported probably from Ontario that was controlled too. So we don't have seen what we see with the other variants, with an explosion. As we had also South African and Abitibi Témiscamingue, it stays there, didn't go anywhere. So it's a marginal phenomena for the moment, but we are following it.
Ketsone, CBC.
Good afternoon. Starting this Thursday, people who got their first shot will be able to receive a digital proof, vaccine proof. Are there any technological or legal restrictions to what companies can do with the QR code? Or is there anything preventing a company from scanning a worker's code before they go into work, or scanning customers before they enter a store? I'm asking these questions because the Quebec Federation of Chamber of Commerce is putting pressure on the government to have such a proof.
Yeah. Well, first, as I mentioned, the first step is just a technology. So when you are at the vaccination center, you will receive an email, and you will be asked if you want that proof first. So you need to confirm you receive that proof then by courier, by email. Then there is no application for this right now at all. And I'm just saying that there is no application because the only group that has the key to be able to read the QR code is us. So until we release the way we should read the code, nobody has the algorithm to read the code. So they cannot be used for anything just looking at the QR code. So, and this is the reason that we wanted to make sure that we release the QR code as quickly as possible. And what we've asked public health is to make sure that, and it's not going to be in May, I just want to make sure that I clear the air. They will take the time to look at where it will be possibly be used. It's not going to be over the next few weeks. So we've asked public health to look. But in the meantime, people will have those QR codes, and they will be at one point able to use it for something. But at this stage, nothing has been decided. And we still have the code, so nobody can read that.
So not before the end of June?
I said that it's after May.
Okay.
After May.
I saw the info from the health ministry regarding the postponing of the second dose for people who received their first dose, because it's from 90 to 112 days.
12
exactly.
Days, exactly.
So what are the chances you could offer finally the second dose sooner, because the vaccine operation is accelerating?
Yeah, but as I mentioned before, but that's a very good question. As I explained, that if everything seems to be going well and we cross our fingers that we still get those vaccines in May, we could accelerate the second dose. But the good news that we had that will have an impact is that now that we need to vaccinate an extra 500,000 people, those are the 12 to 17 years old. And based on the recommendation we'll get from the CIC, the Comité d'Immunisation, they're telling us they would prefer that we do that before the end of school. So it means that it add an additional 500,000 people that we need to vaccinate before the end of June, before they leave the school. So I would prefer obtaining that opinion from SIC this week. I was told I would probably receive it on Wednesday or Thursday. And once we know that, that will be at the end of all the appointments that are being taken by this week of youth, right? So I think by next week we'll know exactly how many appointments we have in May, how many appointments we have in June to complete our 5.3 million doses of the first dose that we have committed. And after that, we'll see where we put those 500,000 students. And then after that, we have a better date to say how we start the second dose, always in the limit of the 112 days. So,
Matt Griot, CTV.
Good afternoon to the three of you. I'm just wondering, is there a plan in place for the reopening of restaurants, terraces? And if so, what would that plan look like?
As the Prime Minister told, there is a plan to look at all those aspects. He wants us to be clear on what is going to be the sequencing, and this is part of the plan.
I know the mayor of Montreal had said they were hoping for sometime in June. Would we be getting an answer before then, you think, in terms of restaurants and terraces?
well, I'll tell you, there is not a day that I don't have that question from the Premier. So I would think that at one point you'll say that's enough, give me that report. So I'm saying that I have enough pressure to produce that as soon as possible. Okay?
Thank you.
Okay.
Do you think that the Canadians were insensitive yesterday, the first time in 111 years where there was no Quebec-born player in the lineup? Well, I think it's unfortunate that there are not more Quebecers with the Canadians. Perhaps one day, if we have the Nordiques, there'll be a competition to see who's got the most Quebec-born players. I understand that Philippe Deneau is injured, Jonathan Drouin is not playing, but there should be more Quebec-born players. I think that when we look at the National League, there are many of them, and in the last draft, there could have been an additional effort made. Is it a structure problem, or is it an organizational problem? Well, listen, I think it starts at the top. And I think that Jeff Molson and Marc Bergevin must be sensitive to the fact that Quebecers like to see Quebec-born players. And if they weren't good, I would say, okay, but there are some very good ones.
Bonne journée.